Hello everyone, we are from Group 8 and welcome to our video presentation on social anxiety disorder as part of our KMF1053 Cognitive Neuroscience course. Our goal is to provide a comprehensive understanding of social anxiety disorder and to inspire further discussion and exploration of this critical topic. So let's get started with the introduction.
Social anxiety disorder is a chronic psychiatric disorder characterized by a persistent fear of social situations due to the fear of being negatively judged by others. It is often misdiagnosed because shyness can mimic some symptoms of social anxiety disorder. Social anxiety disorder has significant adverse effects on work, social development, relationships, academic achievements. And what makes it different from social anxiety disorder individuals and shy people is where they exhibit a negative cognitive bias, judging their own performance and behaviors tests worse than independent observers do. And what can I say? Social anxiety disorder is common among adults and young adults. Based on the demographics and prevalence provided by the United States, approximately 15 million in the US are diagnosed with social anxiety disorder each year, accounting for 7.1% of the population. And most people with social anxiety disorders are diagnosed with these symptoms exhibitly by the age of 13. 36% of individuals with social anxiety disorder do not seek treatment for at least 10 years. That's quite long, okay? And in this purpose of our study, we aim to investigate the subjective and personal experience of individuals with social anxiety disorder, and we seek to understand the neurological and psychological abnormalities underlying the social anxiety disorder patients. And this study as well will explore the various mental health issues, comorbidities associated with social anxiety disorder.
For experiences and mental problems of patients with social anxiety disorder. Social anxiety disorder manifests in patients through intense emotional symptoms such as fear of judgment, negative evaluation, and embarrassment in social interactions. They perceive others as focusing on their flaws and mistakes, which exacerbates their anxiety. This fear extends to being negatively evaluated even in simple conversations, leading to excessive worry about saying something embarrassing or crossing social boundaries. Physically, they may experience blushing and sweating excessively, which can inhibit their ability to communicate effectively. These symptoms significantly impact various aspects of daily life, including academic or career pursuits, relationships with family and friends, and engagement in leisure activities. For instance, tasks like group presentations or social gatherings become overwhelming due to fear of being scrutinized. This disorder can strain relationships as individuals may isolate themselves to avoid social interactions that trigger anxiety. Consequently, they may miss out on enjoyable activities and hobbies for fear of judgment. In essence, social anxiety disorder imposes both emotional and physical barriers that hinder individuals from engaging fully in daily life, affecting their personal, social, and professional well-being.
Hello, my name is Ebony Luisachi with the matrix 101477, and I'm going to continue on. So patients with social anxiety disorder or SAD may also develop comorbid mental disorders such as depression and alcohol use disorder. So in depression, there's a very high likelihood of developing depression within 2 years of the onset of SAD, and it is very particularly prevalent in adolescents and young adults. Moving on, for alcohol use disorders, patients may use alcohol as a coping mechanism to reduce their social anxiety, and by doing this, the regular use can lead to dependence and thereby addiction. Okay, moving on to the impacts of quality of life for SAD disorder patients. So, their impact of their quality of life emotionally, SAD may trigger negative emotions which may hinder them to enjoy life and cope with stress. For their social aspect of their life, it may bring challenges in social interactions which may lead to strained relationship and social withdrawal. For physically, the mental disorder can worsen their physical health, and it may make them find it difficult to maintain healthy habits. And overall effects, it may cause a significant burden on daily functioning and impacting their work, relationship, and self-care. Continuing on, this is a case study of a real life patient with SAD. Her name is Allison, a 29-year-old commercial lawyer with SAD, who experiences discomfort during social gatherings, and she tends to avoid them entirely. She also doesn't believe that she's attractive. Men don't find her attractive despite her being attractive. So she has quite low confidence in herself, and she frequently compares herself to others, thinking they are better, which causes her to be quite anxious and shy when presenting in front of others. So she has some symptoms, which is she has quite a high fear of public speaking and suffers from anxiety and self-doubt about her appearance and abilities. She has a few weaknesses, which is she finds it difficult to do public speaking, and this causes her to have an inability to showcase her natural talent due to her anxiety. And her impacts on daily life, which limits professional contributions and confidence, which prevents her from reaching her full potential. In conclusion, it can be seen that SAD significantly impacts the personal and professional life of Allison, which made her create feelings of inadequacy and limiting her own self-potential.
Next is about neurological and psychological factors contributing to social anxiety disorder. So I'm going to explain more on neurological cognitive factors that play a significant role in SAD. Let's start with the amygdala hyperactivation. Amygdala is a small almond-shaped structure in the temporal lobe which play a crucial role in processing emotion, particularly fear and anxiety. In SAD individual, amygdala is hyperactive, leading to a fear response even when there's no real threat. For example, imagine walking into a crowded party and feeling like everyone is staring at you, even actually when they are not looking at you. That's what it can be like for someone with SAD. Next is hypervigilance and attentional bias. People with SAD often exhibit hypervigilance, constantly on the lookout for potential threat or social cue. They may also have an attentional bias, which propensity to ignore positive or neutral cue in the favor of negative stimuli or information. For example, they're focusing exclusively on negative comment on social media and ignoring positive one. Last but not least is default mode network or DMN. DMN is a network of brain region active during internal mental activity like self-referential thinking, mind-wandering, and daydreaming. In individuals with SAD, DMN is often hyperactive, leading to excessive rumination like getting stuck in a cycle of negative thinking, self-focused attention like difficulty engaging with others and focusing on conversation, and anxiety perpetuation like self-reinforcing cycle of anxiety and avoidance behavior. That's all.
Hello, my name is Nurdiana Arianti binti Muhammad Hisham, and my metric number is 100541. Now I want to start with negative self-belief. People with SAD often have a feeling of inadequacy and a deep fear of negative judgment from others. This content fear leads to heightened anxiety in social setting. fueled by harsh self-criticism and a persistent sense of unworthiness. As a result, individuals find social interaction challenging, impacting their confidence and ability to engage comfortably. Next, emotion regulation difficulties are another critical aspect of SET. Individuals struggle to manage their emotion effectively, especially in social settings. Avoidance of social situations further isolates them and limits access to emotional support, making it even harder to regulate their feelings. Some individuals with SET are highly sensitive to criticism, finding it challenging to cope with both positive and negative emotion in social environment. Last, cognitive distortion are common in SET and exacerbate the disorder. For instance, mind reading leads individuals to assume others are judging them negatively. Catastrophizing involves imagining the worst possible outcomes in social interaction, heightening fear of rejection and shame. This distort create a cycle of anxiety and avoidance, making social interaction daunting and perpetuating the disorder. Next, let's start with discussing medication commonly used to treat social anxiety disorder, starting with SSRI, which is a selective serotonin reuptake inhibitor. SSRI, such as Zoloft, Prozac, and Paxil work by increasing serotonin levels in the brain. This helps to regulate mood and reduce anxiety over time. It typically takes a few weeks for SSRI to achieve their full therapeutic effect. Long-term use may be necessary to maintain symptom relief and prevent recurrence. It's crucial for individuals to follow their treatment plans closely under the guidance of healthcare provider. Now, I want to moving on to SNRI, which is serotonin norepinephrine reuptake inhibitors, which are also effective in treating social anxiety and other anxiety disorder. SNRI, like duloxetine, venlafaxine, increase level of serotonin and norepinephrine in the brain. Also help to regulate mood and stress. They can reduce symptoms such as social avoidance and physical anxiety. Common side effects might include nausea, headache, dizziness, and insomnia, which often improve over time or with adjustment in dosage. With consistent use and monitoring by healthcare provider, SNRIs also can provide long-term relief to individuals with social anxiety disorder.
Next, I'm going to discuss about benzodiazepine and beta blockers. Let's start with the benzodiazepines. Benzodiazepine is the medication work by enhancing the effect of gamma-aminobutyric acid, which known as GABA, in the brain, which has a calming effect. They can quickly reduce anxiety symptoms, usually within 30 minutes to an hour. However, they can also cause side effects like drowsiness, dizziness, and decreased coordination. It's important to note that benzodiazepines are recommended for short-term use only, as long-term use can lead to dependence and withdrawal symptoms. They should be used in conjunction and with other treatments such as cognitive behavioral therapy or CBT. Now let's move on to beta blockers. Beta blockers work by preventing the effect of adrenaline, which can cause physical symptoms of anxiety like rapid heartbeat, trembling hand, and sweating. They are often prescribed off-label for anxiety and can be effective in managing physical symptoms. However, beta blockers do not address the underlying psychological causes of anxiety. They are often used for short-term anxiety related to specific events like performance anxiety. And like benzodiazepine, they can also cause side effects like fatigue, headache, and depression. In conclusion, benzodiazepine and beta blockers can be effective in managing symptoms of social anxiety disorder, but it is essential to be aware of their risks and side effects. Working closely with a healthcare provider is crucial in determining the most appropriate medication and treatment plan.
The experience of individuals with social anxiety disorder are categorized by intense feeling of anxiety, fears, and avoidance in social situations. In neurologically, individuals with social anxiety disorder exhibit abnormalities in brain regions responsible for processing emotions, dangers, and social cues. These include amygdala hyperactivation, hypervigilance, and attentional bias toward negative stimuli, and an overactive default mode network leading to excessive rumination and self-focused attention. The treatment can effectively manage symptoms and improve overall well-being, but long-term treatment may be necessary to maintain system relief and prevent relapse. In conclusion, social anxiety disorder is a complex condition with multifaceted neurological and physiological factors contributing to its development and persistence. Understanding the subjective experience, underlying mechanism, and available treatment option is crucial for providing effective support and improving the quality of life for individuals affected by disorder. That's all from our group. Thank you.